Dr. A. P. Suri is a globally renowned and well-known podiatric surgeon and diabetes foot specialist from India. He has more than 2 decades of experience serving his diabetic foot patients. Dr. A. P. Suri is one of the leading diabetic foot surgeons in India, associated with Fortis CDOC and Diabetic Foot Care and Bone Care Center, Delhi. He is the founder and current president of Indian Podiatric Association. His main field of interest is in diabetic wound management and pressure offloading techniques for early healing of diabetic wounds. Dr. A. P. Suri holds membership of American Podiatric Medical Association, American Association of Wound Care, European Diabetic Foot Study, American Hyperbaric Oxygen Therapy Association, and he is also founder president of Indian Podiatry Association. So viewers, today let's have the direct talk with Dr. A. P. Suri. That what's the motivation behind his special initiative for saving life and as well as saving the lower leg in diabetic patients from amputation. So viewers, let's understand from Dr. Suri his journey into the world of podiatry.
Hello everyone, I am Dr. A. P. Suri. I am a diabetic foot care podiatric specialist dealing into diabetic foot care. My main field of practice is into diabetic wound management and really people who are suffering with diabetes in our country and they have foot problems. So we take care of all the medical and surgical problem from ankle joint till the feet when the people are suffering with this. I graduated from SN Medical College, Agra, and from there I went to US for my higher studies in podiatry. I joined in Beth Israel Deaconess Hospital in Boston under Harvard Medical University, and then the journey started with podiatry in my life. I talked to my mentor here in Agra in India, and he told me that Dr. Suri, if you want to come to India backwards, then you enter into this field of podiatry. And that's how I entered in Beth Israel Deaconess Hospital. Then I did my small fellowship in diabetic wound management and biomechanics of the foot, plantar pressure studies and gait analysis from very prestigious Temple University in Philadelphia. And then I was working in Montgomery Hospital in USA. And from there we decided that there were very few people in the whole country dealing into diabetic foot care. And as you see, we have so many people suffering with diabetes in our country, and alarmingly at present we are something around 77 million people suffering with diabetes. And all these patients who are suffering with diabetes, over the period of years, they land up in diabetic foot complications. If you look at the role of podiatrists or department of podiatry, they are very negligible in the whole country. Very few hospitals are dealing into podiatric care. Doctors as surgeons, vascular surgeon, orthopedic surgeon, general surgeons, physicians, diabetologists, they are dealing in diabetic foot care, but at a individual level or at a clinic basis. But if you look at the podiatry departments, they are missing in our hospitals. That made me to come back to India, and way back in 2001, and then I started my practice into podiatric care here in New Delhi. At present, I am the director of diabetic foot care and wound care center at Narayana, New Delhi, and head of department of diabetic foot care center at Fortis Hospital in New Delhi. We started with this journey in 2001, and by 2009, we tried to make people to join us in different parts of the country, and we thought of bringing up an association of Indian Podiatry Association. With this association, we wanted really to generate awareness of diabetic foot education in the country and spread this education among our colleagues so that they can enhance their knowledge and they can use these practices of diabetic foot procedures and what best are the things they can use in their clinical practices so that they can really save these patients from amputations. With this, we started with a core group including Dr. Ravi Kamipli, who is an infectious disease specialist working in Ohio in US, Dr. Rajni Saxena from Ajmer, Dr. Sanjay Kale from Kanpur, and many other people who joined us, and we started with the core group of Indian Podiatry Association. To take the name of Indian, we really need members from 10 states of the country way back in 2009. From 2004 to 2009, it took me about 5 years to join different people from 10 states of the country, give them a vision and mission of Indian Podiatry Association, develop the constitution of Indian Podiatry Association, and then successively in 2009, we registered our association. We started with a small group and we launched a small conference in Delhi, having something around 100 people. We booked a hotel and we generated the awareness for this diabetic wound management and diabetic foot care. But luckily, we crossed the registration till 740. And we have to twice change. Once we have to change the venue inside the hotel, and once we have to change the hotel itself in 2009. That showed us that so many people are interested among doctors like MBBS level doctor, physician, diabetologists, general surgeons, orthopedic surgeons, plastic surgeons, even vascular surgeons. So many people in 2009, they were interested in diabetic foot care because diabetic foot care was missing in all the departments in our hospitals. And with this, we started the journey, and 4 times in a year, we started with developing these. Rather than doing a conference, we started doing workshops in diabetic foot care. These workshops were hands-on workshops, and luckily we joined with 1 or 2 companies in India, and one of them was very affectionate and very forward. They came and joined with us, with me, myself. And then we started getting doctors from all over the country, and 4 times we started that. And that we have been doing for last 10 years now. We have been able to train more than 4,500 doctors all across the country, mainly being diabetologists, physicians, general surgeons, even MBBS level doctors. And we are proud to say that they have been able to imbibe this knowledge in their country, in their hospitals, in their clinics, and they have been really saving people from amputation. If we look at diabetic foot care, the main aim is early identification of diabetic foot complications. This is very important because early they identify the patient with neuropathy, patient with peripheral vascular disease. That's how we can really prevent them from amputations. Under the banner of Indian Podiatry Association, we had now 17 state chapters from Gujarat, from Madhya Pradesh, Tamil Nadu, Karnataka. We have a chapter in Kerala, Uttar Pradesh, Punjab, Haryana, Chhattisgarh, Gujarat, Rajasthan, and that's how the journey started. From 2011 to 2018, we were very lucky to develop 17 state chapters of our Indian Podiatry Association. I myself took the beam in my hand and started training people because I knew that until unless we give training to these doctors, we will not be able to develop podiatry or diabetic foot care in our clinical practices. And that's how the low role of amputation or level of amputation has to be decreased. Because we all know that people who are suffering with peripheral vascular disease, very quickly with the small injuries, they can land up with an infection or ulceration or gangrene like this on the toes. Because early identification is very important. Similarly, if they have high pressure areas, that is very important to early identify these high pressure areas, and we can save these people from really amputations. So IPA stands for Indian Podiatry Association, I Prevent Amputation. Thank you so much.